their dream is over. Okay, so all of that is going to fall to the wayside. What you're already seeing in insurance, and I'm one of them. I haven't used normal insurance for a decade. I pay cash to a
Mm-hmm.
concierge physician,
Mm-hmm.
and that goes directly to that individual, and they take care of me. I
Mm-hmm.
use insurance only to pay for labs. The other reason I do that is because I'm in healthcare, and I know that clinicians are not the same. Insurance treats all clinicians the same, which is Dr. Ann and Dr. Michelle are in the same network.
I love when coaches, consultants, and professional service providers want to do big things in their business. They want to rise to the top and influence their market and the world around them. They want to have a greater impact and make a more lucrative income. Well, if this is you, welcome to Expert in You podcast, the show where I interview other experts and coaches, consultants, so that they can share their success strategies with you. We're going to talk about marketing and how to close more sales, how to get more premium clients, and how to really build your visibility in the market and scale your business like a boss. If this is you, welcome to the show. I want to ask you to subscribe and hit the notification bell right now so you don't miss one episode. Grab your coffee and buckle up because we are ready to give it all to you to help you become the expert and get paid as the expert that you are. Hey everyone, welcome back to another episode of Expert in You podcast. I'm your host, Ann Carden. So excited to be back with you again because I have a very cool guest. Her name is Michelle Harmon. She is a healthcare executive, a clinician. She works with executives as a behavior strategist. So this is going to be an amazing show. She has been doing this forever, and I love it because she's actually kind of in my neck of the woods, a few hours from where I live, and that's kind of how we connected. So Michelle, welcome to my show.
Hi, Ann. Thank you so much. I appreciate that opening. The only thing I want to tweak is that I'm not a clinician, I'm a clinician advocate. So I've
Okay, my mistake.
no
Okay.
worries, no
All right.
worries. My brother is an MD. My mother was an OR nurse, family of healthcare, and that's how I got interested way back when.
All right. Well, we're going to dive into that and then talk about what you do now and where all of your brilliance is. So let's just go back a little bit and tell me kind of how you got into doing what you're doing right now.
Excellent question. So I got out of grad school a long time ago and decided that healthcare was vast. And the healthcare program was really focused on being a hospital administrator. That wasn't of interest to me. I went to work for E&Y, Ernst& Young, back in the
Mhm.
day to become a consultant. And that kind of setting really created curiosity in process and people.
Mhm.
And really my consulting is what took over. So when I went to work for Ernst & Young and KPMG, the task was they are accounting houses that partnered with health systems. And then what came through that was selling of strategy work. So mergers and acquisitions was happening in the early and mid 90s. The nuns were
Mhm.
running a lot of healthcare. You don't see the nuns anymore. They're here in name.
Interesting. That's
They're
interesting.
here. Yeah, they're here in name only. But in the 90s, when I started, we were doing a lot of non-for-profit
Mhm.
Catholic with non-for-profit, non-Catholic, and we had the issue of abortion. These issues are still here.
Mhm.
But that's how I got started. And really, my focus is the 360 of healthcare.
Okay, so let's talk about that a little bit. What do you mean by the 360 of healthcare?
Great question. So healthcare is balkanized. If you look at insurance or payers, you can have a complete career in that and never come up for air and actually deal with a clinician. That the clinician is actually delivering the work, but you have an entire balkanized vertical that doesn't touch a clinician. That's just one. That's called the payer. It's not working, by the way. You can hear how many people complain and moan about their insurance bills. That's one
Right.
vertical. You
Oh,
have
it's a
another.
nightmare.
It's a nightmare, right?
Yes.
And it's not working, and we're still using it. And you're going to see a lot of change in that. We can talk about that a little bit later, but that's just one piece of it. Then you have pharmaceuticals. And you guys have
Mhm.
learned a lot about pharmaceuticals through Hulu and all these other stories where we have some bad actors happening there too.
Right, right,
What the public has found out is that physicians are actually, or let me use the word clinicians, are actually trained by the pharmaceutical company.
right. I think
And
a
so
lot of
there's
people know that. And they also think there's a lot of kickbacks in there. And that's why doctors push certain prescriptions and they say they're not, and they say it's against the law. But what do you think about that?
Well, what I'm saying is the systems don't serve. How about that?
Yeah.
They don't serve.
Okay. That's
There's
a
a lot of
very diplomatic way to say it, Michelle.
Thank you, thank you. So we talked about the insurance people and everything you said about pharmaceuticals. We're saying that about insurance too, right? We're saying that you guys
Right,
aren't doing your job. Then we come to the pharmaceuticals and we're saying you guys aren't doing your job. Then
right.
we go, did you guys know that the government is your biggest payer of healthcare? That's Medicaid and Medicare.
Mm-hmm.
Well, all you have to do is Google that and it's not working. And
Mm-hmm.
then we get to this huge thing called a clinician. And you guys heard about this thing called the pandemic. What we're learning and what the public is slowly going to find out is we don't have enough clinicians. Now,
Right.
we've known this for decades. The government cut all graduate educations a long time ago. We
Mm-hmm.
knew around the early 2000s that we didn't have enough doctors. We didn't have
Mm.
enough specialties. Now, here's where it gets fun. And what did we do about it?
Nothing. Right.
Nothing.
I work with
Nothing.
doctors. I work with a lot of doctors, and I have learned so much about the healthcare system working with them and the stories, and it's just heartbreaking. Like we sort of know it, but unless you're in that world, you don't know it for sure.
Right.
And it's
Right.
been unbelievable to find out a lot of the things you're talking about.
Right. I've worked in health system my entire life. I've also worked for a self health system. I've also worked for a vendor that was selling something to the health system they need. I was
Mm-hmm.
frequently in meetings where they didn't know each other. So I'm working in a health system on a team that's touching the same thing and they don't know each other.
Mm-hmm.
Now, what we're talking about is healthcare is made up of all these huge verticals that don't talk to each other.
Right.
They also steal money from each other because if you take all this money in the PPP, which is the pandemic money, right? You're starting to hear all
Mm-hmm.
about all that is we
Mm-hmm.
gave out the PPP, but I don't think it went where it was supposed to go.
Mm.
42 states have filed with the attorney general that that money got lost somewhere. And that's what we're talking about is these systems. When you talk about healthcare, we're talking at least four or five systems in that one word of healthcare, and we don't talk to each other.
Mm-hmm.
And everyone's like, well, healthcare doesn't work. Well, we've set it up that way, and
Right. Right.
we set it up to be exactly the way it is today.
So, Michelle, you work at 360. What do you actually do to help this?
Excellent question. I typically work with the executive who's driving. So this would be the CEO, a CFO, a chief medical officer. It could also be a private owner. There's a lot of entrepreneurship in healthcare. I've been with 8 separate companies throughout my career that were individual entrepreneurships.
Mm-hmm.
So that's the other part of it. When I say 360, let's talk about the owner that's owning the company, like you, Ann.
Mm-hmm.
You know that all that comes on the head of that one owner and how are they functioning in life.
Right.
So the same day that they're getting a divorce, they have to negotiate the biggest tech contract of their life.
Mm-hmm.
I sit with executives to make sure they're whole is the
Mm-hmm.
fastest way to put that. But we're looking at how they take care of themselves. That's
Mm-hmm.
physically, spiritually, and mentally. And what issues does that executive have within them that is creating more chaos outside of them? So one of the first things I do is help the executive understand if they're creating their own problems for themselves.
Right.
Are they in the right spot? What's the dynamics of the team? But really, with an executive, and the first step is the only really issue going on here is you versus you.
Right.
And you get called as an executive coach, you get called because this is the problem. Make those people go away. Michelle, prove that they're wrong, right? This is
Right.
why we get called. Can you tell them they're stupid? Make
Yeah,
them
they
go
don't
away.
want to know that, hey, the buck stops with them, right? And just like
Right.
it stops with me. I am the driver of my business. If I mess up, it's on me. If I do, all of everything's on you. You're responsible.
Right. And the other thing that we've noticed is people are not signing up to be CEO anymore. And have you seen this? No one wants the big job. And why? I'll tell you why. It stinks. It's not a mystery. So the public again is like, well, why wouldn't you want all that money? Why wouldn't you want all those things? Well, you're completely isolated when you're at the top.
Right, right.
And so we've got all these issues with how hard it is just to be a human
Mm-hmm.
today. And
Mm-hmm.
then on top of that, you're leading. You're also leading in a post-pandemic world as an executive. We've never had these issues since you and I have
Right,
been alive.
right.
We are in labor shortages that only World War II executives
It's
faced.
crazy. Yes.
Yes. So when I say 360 and the executive hires me, they are looking to grow. They are looking to
Mhm.
change. They're also conscious of the fact that they may have a glitch. I typically don't do well with a CEO who doesn't understand they're the glitch, or they
Mhm.
may have some glitch that's impeding change. Those people are not for me.
Mhm.
But when we look at the individual and we do an assessment about what's happening for you personally, what's happening you in your inside your markets, and then what's
Mhm.
happening with you inside the business,
Mhm.
that's the 360. And the other thing is I don't leave my clients. So I have the joy of watching my clients grow. I'm very interested in the different segments of the career. You know, this is a executive coach. My legacy leaders are different from
Mhm.
decade to decade to decade. And how do they still stay viable? How do they create legacy? All of those things are extremely challenging in a post-pandemic world.
Mhm.
And that's the type of work that I do.
Why do you think there's such a labor? I know this comes up a lot, Michelle, since you're in this world working with CEOs. Where do you think all the labor shortage is coming from just because we're coming, just because it's post pandemic? Like, where did everybody go? Why are people not wanting to work? What's going on there? What is your insight? I would love to know.
Okay, so before we had a global pandemic, healthcare sucked. We didn't
Hmm.
need this. Okay. So this the other thing I want to educate the public on is healthcare was already very hard. It's been very, very hard for a long time. And what these entrepreneurs that get into the healthcare space and flip a company for money, they're trying to get out. Like this isn't healthcare isn't sustainable.
Mm,
We've all known this. Okay. So I started talking about in the 90s when I was working with nuns who we don't see anymore. And they were taking care of poverty. They were taking care of illness. They saw it as an extension of their
hmm.
soul world. We now have private equity in healthcare.
Mm,
So it's very difficult to talk about what happened. It's a tidal wave of events that have been going on for decades. And so what I tell everybody about the pandemic is everything was already blown up. You just didn't know it. We didn't have any nurses. We didn't have any doctors. We were missing specialists. It's horrible. Everybody that can hit their big nut, whatever that is, I flipped my company. I've been
hmm.
CEO for 10 years. I've stacked away that SERP plan. If they can get out, they are.
Mm,
And there's a lot of folks that decided after this pandemic, because we didn't do the pandemic well. We're starting to see all this, aren't we?
mhm,
We're starting to see we didn't really handle that really well. And so what I tell everybody is this isn't new. What you have now is a labor of shortage that you weren't paying any attention to
mhm,
pre-pandemic. You weren't. And I write about all this. The blog that I picked out today is called Kick the Can. And it is about status quo leadership. Now, Ann, I just
mhm.
told you we knew a long time ago that we didn't have clinicians. And now everyone wants to say, what's the big deal? Well, you've known.
Right, right.
You
But
you decided you weren't interested. The other thing I will tell you is we don't educate clinicians. So that's a huge issue that's getting ready to
mhm,
blow up. We don't pay to pay an educator. And you know,
right.
you see it in all your education deals. But when it comes to clinician education, that's a mess and has been a mess. We don't invest in it. We're going to have to reimagine how we train and how we get people interested. Right now, you have literally women, and I'm saying women because they're still the majority, but I've got kids going to nursing school, coming out of nursing school, and day one going, this is not what I want. That's different too.
Yes. It's interesting. One of the things that I've really learned, I think about one doctor I'm working with who is a client, and she talks about the shortage of doctors and all of that. But not only that, something that people don't know. First of all, they really are supposed to be herding cattle, us mainly in the profession. They're burned out, they're exhausted. But not only that, if they want to make the same amount of money, because insurance keeps cutting what they get reimbursed for, keeps cutting into their basically into their money, they have to work harder. They have to trade more time
Right.
for to even stay at the same level. That's not even including inflation or anything else. And so I want to ask you, Michelle, are insurance companies and pharmaceutical companies, are they making the money?
Their dream is over. Okay, so all of that is going to fall to the wayside. What you're already seeing in insurance, and I'm one of them. I haven't used normal insurance for a decade. I pay cash to a
Mm-hmm.
concierge physician, and
Mm-hmm.
that Goes
Hmm.
directly to that individual and they take care of me. I
Hmm.
use insurance only to pay for labs. The other reason I do that is because I'm in healthcare and I know that clinicians are not the same. Insurance treats all clinicians the same, which is Dr. Ann and Dr. Michelle are in the same network. Well, Dr. Ann and Dr. Michelle are very different. I need Dr. Ann for this, I need Dr. Michelle for this, and
Right.
I pay for that. So, what you're going to see now in the next decade is insurance is going to have to be reimagined. Okay,
Hmm.
what we're hearing out of insurance is we don't have the dough.
Right.
We don't. I talked to State Farm a month ago. They don't have these vast buckets of money. Okay. And that's all because again, you're going to hear this theme when I talk and speak about we have known about these issues and forever. It's not new. So, what are the market forces? What are the industry forces that have kept you from doing what you're supposed to be doing? That's where the real question is. You guys have all known this. What your doctor is telling you. I heard that same shtick in 1987. It's now June 12th, 2024. So I just push right back to healthcare and go, you know what you're doing.
Hmm.
You know what you've been doing. You've been hauling money out. And now we're all here. And it looks like the Lorax.
Michelle, how do you do it? So I want to just talk about you for a minute.
Sure.
You're I can hear your passion, first of all, for what you're doing, but I can also hear your frustration for what you are doing. How do you do it? How do you stay in the industry, continue to do what you're doing, and not basically burn out or say it's hopeless? Like there's just no hope here. How do you do it? Because I think that can be a good lesson for people, whether they're in their own business or they're working, whatever they're doing. I think it can be a great lesson. How are you doing it?
I have great people all around me. There's not tons of them, but there are leaders everywhere that understand we have work to do.
Mm-hmm.
And they're very smart. They have been held back. One of the themes that, and you and I have talked about this, is high power people have been sitting behind low power people. Um,
Yes.
Congress is a ubiquitous way for me to talk about that. How old are they?
Right.
Okay.
Let's
Can
just
we
not go
agree?
there.
Can we just agree? Okay. So, but the deal is they're you have to talk about them because they're a pattern for the country.
Exactly. No, so
Okay.
true.
But that's what's going on. So the deal is I have tons of really great executives who just haven't been given a shot.
Mm-hmm.
And they're brimming with all of these ideas around certain things like workflow. Healthcare, your physician that you're working on, my question back to that person was, when's the last time you hammered out your workflow? They haven't.
Mm-hmm.
They haven't. And so what has to happen is we really have to break down what we're actually doing. And we haven't done that. We just pave over it and pay you, pave over it
Right.
and pay you, pave over it and pay you. Healthcare, and what I'm excited about is that it's going to blow up. It has blown up. It's not working. You have conversations every day. This is what I hear. Healthcare is broken. And my
Mm-hmm.
answer is that not news.
Right.
That's not news,
Right.
guys. We have this big collective sigh because we're through the pandemic. But
Mm-hmm.
I'm here to tell you guys this has always been here. And if you go over to transportation, same answer. If you go over to education, same answer. If you
Right.
go to Congress, same answer. So one of the
Basically anything the government's involved in, right?
I
Let's just
can't
call
say
it
it
spade a spade.
right, but I can't see any better for the privates. Okay.
Yeah.
I watch all you privates and you guys don't do any better. So what I'm excited about is everything is crashing at the same time. And we've got really smart people saying, wait a minute, we have a lot of connectedness between here. What's
Mm.
wrong in education is what's
Mhm.
wrong in healthcare, is what's wrong in transportation, is what's wrong with the military. And there's a
Mm.
ton of leaders that have been striving and they're not used to be on in their trailer and they're not used to specific things that the folks above us have been used to. And we're going to reimagine how we lead. And
Mm.
that's right now what's so exciting for me because all of that is blowing up. And as a coach, systemic death, if you will, is what we need for change. And I'm excited because that's happening because I don't have to fight anymore. Like in 1994, it was like, do you guys think this is working? The nuns are crying. Is some things now, and I was 25, and
Wow.
nobody sort of noticed that. I remember this specifically. I told the partner at KPMG I did not go to grad school to make a nun cry. And that's
Interesting.
when I started noticing, hey, something is wrong. And then we just keep paving over it. So that deal got done. It was in Salina, Kansas.
Mhm.
That deal got done, and we just keep going.
Things don't happen until they hit rock bottom. I don't know why that is, but it seems to be
You're a coach. Why is
it
that?
seems to be the norm. I see the same thing in business. People don't, they're not proactive in what they are trying to do in their business. They're reactive. And so all of a sudden they don't, this is going on and now I have to fix it. Why didn't you do what you needed to do to make sure that that didn't happen? Yeah, but I think that a lot of that's just human nature. I think we
It
tend to,
is. We totally agree. And then the other thing that we're all in love with is the scapegoat.
yes. Oh, the blaming and yes, it's
We're
everybody
still doing
else's
that.
fault. Right.
We're
Yeah. That's never going to change. But FYI, for all of you entrepreneurs out there, you are you are responsible for everything that happens, good and bad in your business. You are.
You are, especially if you're taking that check.
So true. Oh my gosh, Michelle, we could talk about this all day. Wow. We could get into some really, really deep discussions about this. So what do you want people to leave with? Give us 3 takeaways that you think are super important for people to know or could change something?
Number one is don't be bummed. Number one, we've got a mental health issue. Okay, 50% of us are walking around with depression and anxiety. This Congress, what's happening here is scaring the tar out of
Yeah.
everybody. First thing I want everybody to know is stop with this. Okay, we're just changing. Okay, we're just
Mhm.
putting on a new pair of pants because the old pair of pants don't work.
Oh, I like
So
that. That's good.
okay, so that's just number one is calm down. The other thing is two, look around. Okay, everyone is on fire.
Hmm.
Everyone. We just talked about, do you want me to bring up Boeing? We
Oh,
got big
right.
problems.
You
Okay.
and I
So,
talked about that the other day. Yeah.
right, right. So the first one is it's okay. The second one is look around you.
Hmm.
We're all at the same marker. And the third thing is there's way more opportunity and breakdown. And you hear the younger crowd talking about no opportunity. They're not wrong about that. And when we start to really look at, let's say we peel back nursing education, what kind of jobs would we create for people that are actually very interested in this? You have to reimagine how you teach.
Hmm.
We are creating nurses that can't lay a pick line. That's a big problem. We haven't figured that out. How do we reimagine that and then create abundance for teachers around nursing because we all need a clinician? We
Hmm.
haven't cared about any of that.
So you think that's all going to change? Do you see that? Is that Michelle's
It's
prediction?
gonna be forced to. It's gonna be forced
Yeah.
to, but we're gonna have a lot of pain before we do that. You just said
Yeah.
people don't change. So I'm gonna make some predictions. You are gonna pull up to an ER, an emergency room, and no one's gonna walk out. You are gonna pull up to a hospital and it's gonna be closed. You are gonna have a quaternary need in your life. Let's say you start to get an eye issue and you need a neuro-ophthalmologist. I have a very good friend going through that. There isn't one. So this is what I'm predicting is that because people are people, we're going to really walk into the fact that we don't have the care that you pay for. That's going to be very interesting because you just mentioned how expensive healthcare is. We talked about how ugly healthcare is.
Hmm.
And then I'm like, oh, wait a minute. You paid a ton and then there's no
Right.
nurse.
There's no one. Yeah. So how do you see that changing though, Michelle?
Well, so first, again, it's through education. Okay, so we're not creating clinicians. You cannot yell about clinicians when you don't create them.
So
So
you
that's
see that that's going to that they will, like you said, they'll be forced. They'll be forced.
that's the only thing, that's the only way
Mhm.
that it happens. And
Yeah.
and the other thing that I'm interested to see is everybody's talking about AI in a hospital and then how it's
Mhm.
going to fix. I'm like, AI does not hiney wipe.
Yeah.
And this is where we're at in terms of we just need basic caretakers and the
Right.
system has to be reimagined because we don't value
Mhm.
caretakers. We don't value teachers. We don't value people that provide care. That
Mhm.
expands into clinicians. You have
Mhm.
a culture that doesn't value caregivers. Okay. But we all need them. Isn't that strange?
It's so interesting though, because when you talk about culture, I don't think it's I don't think it's the people using clinicians and the people like if you think about the status of a doctor, you think about the status of a nurse, they still, I believe, in our normal everyday lives we do value them.
That's in the middle of changing though. Ask how many doctors today would quit. It's that needle has gone from no one, because it used to be a family of physicians. The
Mm-hmm.
grandfather was a physician, the father's a physician, and it's happening that way. When you actually talk to a physician today and they went through 15 years of experience, they
Mm-hmm.
can't offset that with what they're
Right.
making. And it's not always about cash either. And these people are highly intellectual people.
Mm-hmm.
And some person in a room this big tells them that they can't operate. They're put in situations where they can't execute, and they were
Yeah.
trained to save.
We see that if you have any kind of a problem, the protocol is first you have to do this test and then you have to do this test. And before you know it, you're 6 or 8 months down the road before you actually do the thing that the doctor would have recommended to begin with.
That's
Because
all
they
about
make,
money.
yeah, they make them go through all of these different things. That's something that has been frightening for a very long time. And I think you did just say it. They're not valued within the healthcare system.
No.
We may value them, but they're not valued within the healthcare system because they are not allowed to practice the way they need to practice and do the things that they need to do, that they need to do to get the results. And that is, yeah, that is definitely broken.
We were healing in healthcare, and then we saw all that extra money. It was 16% of the gross national product now, and it sits at 25. When I was in healthcare, you did not have private equity in healthcare. When I graduated in the
Mm-hmm.
80s, there was
Mm-hmm.
not private equity. You now have private equity, and I have sat on several companies. They weren't about healing a patient. Now, I'm
They
not
were.
saying they don't need all this other stuff, but
Mm-hmm.
we have to reimagine what we're here for. The other
Right.
question I have for everyone is should healthcare be treated like we treat capitalism? Do you have control over the fact that you need a appendix? Do you have control over the fact that you have breast cancer? Well, guess what, Ann? We're treating it like you have control over the fact that I want a Lexus.
Right.
These are huge questions. Is healthcare a right? Now, you have a ton of Americans that say, yes, it is. And I'm like, great, write a check. If you think healthcare is a right, 50 cents of every dollar, then 75 cents of every dollar, then 90 cents of every dollar is now going to pay for healthcare. And this is where Americans, you said, what's going to change? This is going to get very transparent. The things I've been talking about in healthcare have been hidden. People did not know that pharmacy educated the doctor. And they did not know that the pharmacy was schlocking whatever they did. They didn't know that. That's brand new information that you guys understand that. It's brand new information that you understand we don't have enough clinicians.
Hmm.
These are all brand new ideas that all of us in healthcare know. And the public is going to get angrier and angrier. But we're still there yet. Most Missourians don't know the rate of Missouri hospital closure. Most
Mm-hmm.
Kansas citizens don't know the rate of hospital closure in Kansas. They only find out when they get very sick and they need something.
Gosh, that it is hard to not be nervous about those things. You said don't be bummed, but it is hard when you hear these things to know that yes, these things are going on. And all right, Michelle, I know we could just talk forever. So, but I value your time. How can people get a hold of you? How can these executives work with you?
They can hit my LinkedIn at any time.
Perfect. And I highly recommend it because as you can hear her passion, Michelle is about change. She wants to make a difference in the healthcare system. She wants to make change. She's been doing this since the 80s, clearly has the expertise and has, what was happening back then and seen how things have transpired and what's happening now. And there are not people out there that have been doing things as long as you have, not a lot of them that really have all of that experience and that knowledge in the healthcare system. So
That's
you
so
are a
kind of you.
gem, my girl. You are a
You're
gem.
so kind. I just like I didn't die. That's what happened, Ann. It's like something should have happened. And it's like being in all these scenarios for as long as I've been in, I have the ability to connect the dots. And it is no surprise to me that we are here. But
So
it's very
good.
exciting. We have to fix things. It's time.
Yeah. And I love the attitude too. It's very exciting because, like she said, it's not going to change. It really doesn't change until you hit rock bottom and you have to make change. It's like, okay, it all blew up. Now We need to do something. And it
Right.
sounds like we are there. So thank you for
Yeah.
sharing and really enlightening my audience. I love this because I think this is important for people to know, but also to have the hope that, hey, okay, we're going to be on the upswing, right? We're going to see something different. So thank you so much, Michelle, for being here, sharing this. God bless you for all the work that you're doing. And
Thank you.
just even the voice that you are having and the boldness that you have brought to this show. I really appreciate it because we want to be real. We want to be raw on this show and just say it like it is and be transparent about things. So thank you for just being so open and honest about everything. I appreciate it.
Thank you, Anne. I appreciate you too.
All right, everyone. Thank you so much for being here. And by the way, sharing is caring. So make sure you subscribe to the show. We are trying to get Expert in You to the top 1%. Right now, it's in the top 10% in the world, but we want to get it up there. We want more people to be exposed to amazing people like Michelle. You know, she's a world changer. She's out there trying to make a difference. We're all, as coaches, consultants, professional entrepreneurs, trying to make a difference in this world. So please share it and subscribe to the show. Until next time, God bless you. Have an amazing week, and we'll talk next time. Bye-bye. If you've enjoyed this show, then I want to invite you to check out a free automated webinar where I show you how you can bring in ultra high fee clients for $25,000 to $125,000 or even more. I show you how you can do this maybe even in the next 7 to 60 days. So if you want to check out that free webinar, just go to expertinyouaccelerator.com and I'll see you on the inside. You have an amazing day, and until next time, God bless you. Go rock your business.